In this video we will equilibrate the Columbia dentoform. The objectives are as follows. Eliminate premature contacts and establish even distribution of centric stops. Eliminate anterior and/or lateral slides of the lower arch, which may be evident upon tight closure and centric occlusion. Establish smooth canine protected function on working sides. Eliminate heavy occlusal contacts on non-functioning sides in lateral excursions. Eliminate all contacts on posterior teeth, when the lower arches move protrusively.
Instruments for this exercise are strips of 28-gauge green inlay wax, black and red mylar marking ribbon, ribbon holder, straight handpiece, carborundum stones, and rubber wheels. Locate and adjust premature contacts by visual inspection, green wax, and marking ribbon. When the upper and lower arches are closed without applying pressure, it may be noted that only a few teeth have occlusal contacts. These contacts represent prematurities and their exact location must be determined. Strips of softened wax are placed between the upper and lower teeth and the arches tapped together. Perforations in the wax indicate premature contacts. Following this initial identification of premature contacts, their exact location and registration is accomplished with a black mylar ribbon. An anterior and/or lateral slide of the lower arch may be detected when the arches are closed together under pressure. The location and registration of the interfering inclines follows the same procedures as described for premature contacts. Carefully adjust contacts with a stone. Stable centric occlusion is established by selective grinding according to the guidelines presented previously in this section. Adjustment in lateral excursions. During occlusal adjustment for lateral excursions, great care must be taken to leave undisturbed the previously established centric stops. Prior to starting the lateral movements of the lower arch, the centric stops should be carefully marked with a black ribbon, then the red ribbon inserted and the lateral contacts registered in red. In this manner, the operator can avoid the centric stops, and limit his grinding to the interferences, which are marked with red only. On the working side, it is desirable that the teeth in the dentoform are in a cuspid protected arrangement in working occlusion. Our goal is to attain and preserve cuspid protected on the working sides. Grinding the working side. Selectively grind the lateral contacting areas distal to the cuspids marked in red, until the lateral stresses are evenly distributed on the cuspid, and none of other teeth are contacting on the working side. The adjustment of the non-functioning side is done in conjunction with the adjustment of the working side. The procedure for registration of interferences is identical to those used on the working side. All heavy contacts on the non-functioning side should be eliminated, even if it demands sacrificing some of the centric stops. The adjustment of protrusive is similar. Register the centric stops with the black ribbon, then insert the red ribbon and slide the lower arch forward, to edge relationship. The protrusive contacts marked in red should be evenly distributed over the incisors and/or cuspids, and any heavy contact on the posterior teeth should be eliminated. Following the establishment of stable centric occlusion, smooth movements in lateral and protrusive excursions, and elimination of heavy contacts on the non-functioning sides, the incisal edges and cusps may have to be reshaped to gain optimum aesthetics and functional efficiency. The occlusal anatomy of the posterior teeth may need to be sharpened to improve mastication, but care must be taken to avoid disturbing the centric stops. When the grinding has been completed, all rough surfaces should be smoothed with rubber wheels. Light pressure should be applied to the rubber wheel, to prevent obliteration of the occlusal anatomy.
Articulation markings are shown in this slide. Heavy marks are characterized as a target-shaped dot. This is usually caused by a premature contact. These should be adjusted first, until all markings are of approximately the same intensity. A sliding contact is also demonstrated. These contacts cause trauma to the teeth and supporting tissue and should be eliminated. Green 28-gauge inlay wax is an excellent adjunct to the blue ribbon in locating premature contacts and interfering inclines. The wax is softened, placed between the teeth, and the arches tapped together. When utilizing the green wax, it should be placed over both sides of the mouth. After tapping the arches together, the wax is carefully examined for perforations, which are indicative of premature contact. A close-up view of a perforation on the buccal cusp of the first lower premolar.
The ribbon is placed between the teeth and the arches tapped together. The resultant markings show an uneven distribution of the eccentric stops, and indicate areas which have to be adjusted.
A more favorable distribution of eccentric stops is demonstrated. Visual examination of the dentoform, when the arches are closed and eccentric, and under heavy pressure shows an exaggerated lateral shift of the mandible. This shift or lateral slide upon tight closure indicates some interference, which has to be located and eliminated. When the adjustments for eccentric occlusion are completed, the lower arch is moved from eccentric position to lateral excursion and the distribution of lateral movements examined. All lateral contact posterior to the canine is eliminated. The non-working side is examined for contact. The tooth is adjusted with a white stone. Next, the model is examined for posterior protrusive contacts. Posterior protrusive contacts are eliminated. Contact on the anterior teeth is adjusted on the lingual of the upper teeth. The may be repeated until contacts are equally distributed.
Completion of the equilibration. Polish all surface with rubber wheels. Clean off all markings with alcohol. The dentoform equilibration should be checked each time a tooth is changed. The dentoform should have no visible rocking when closed under pressure. The canines are touching. The working side is canine protected. There are no non-working or posterior protrusive interferences.